All right, let's give a right of reply now to the SAPS on this issue of the mental health of the officers, and if there are, of course, any support structures that are being put in place, are they adequate, and do they deal with the challenges of the day? We speak now to Major General Busi Temba, SAPS's Employee Health and Wellness Head. Good evening to you, Major General, and thank you so much for your time. Firstly, we just spoke to SAPO. They accuse you of, as a department of being reactionary and simply not having enough resources in order to be able to deal with the challenges that are faced by some of the officers, and even going as far as saying that some of the officers go home without being adequately debriefed after seeing gruesome scenes. Is that true?
Good evening to you, Bongiwe, and your viewers, and thank you very much for the opportunity. Some aspects of what SAPO is alleging are true and others are not. There are resources within SAPS to make sure that after exposure, employees are being given support through the professionals that are within employee health and wellness. We've got psychologists, social workers, chaplains, and nurses, but they are not enough. We don't have adequate resources in terms of human resources to can cover every police officer after every incident. But the resources are there to offer support and debriefing services to police officers.
So if you're not able, pardon me, so if you're not able to cover all of them, it means others are falling through the cracks?
No. It becomes a matter of not responding timeously, but we do also have our health partners, that is the medical schemes that are offering services to SAPS employees, your PolMed and your GEMS, where they also have a network of providers where if employees are in urgent need and cannot be totally covered within SAPS, we also have that partnership where we refer them to our external partners as well.
And what is the uptake like?
The uptake currently is not at the level where we would like us to, where we'd like it to be. With the employee assistance program, according to the EAPA standards, the uptake is usually around 16-17%, and SAPS, our current uptake is around 9%.
Now, when you then hear from a union who say that you need to take this particular function outside, in totality, outside of the SAPS, because you do have an issue where some of the high-ranking officials will not want to go and debrief to lower-ranking officials, and this is something that is also cited as a challenge by the unions, and therefore they're saying that maybe outsource this completely.
I do not agree with the issue of completely outsourcing the current service delivery model, because, like I said, we are in partnership with external service providers who offer services who offer complementary services to our members. So yes, rank does become an issue in some instances, but most of our employees who are on the coal face of things are warrant officers and constables. And the entry level for ESW professionals is mainly warrant officer and above. So we do have adequate members with higher rank to offer services to those members who are offering services like on the ground. So yes, we understand, because within the military environment, rank is a big issue, but for those who are mainly in need of services, they are mainly our warrant officers and the constables. Then the higher ranks, they also have an option of referring themselves externally. And even within ESW, we do have high-ranking officials, even though the number is quite limited for now.
And I know you talk about numbers that are limited, and sometimes in some cases you make referrals to, some of your partners there. But let me paint a scenario for you, for example. There's a warrant officer who goes into a scene right now, sees a gruesome scene, comes back. There's not enough resources at a police station for them to be able to be attended to. There's a referral possibly to tomorrow, and then that person goes home. They enter into an argument with a spouse or someone in their home, and they are so under pressure and stressed that they do something that they regret. That particular scenario is one where we've seen in some instances and reports. Are you not concerned that at the rate at which it's going when it comes to the issue of resources, you need to be beefed up as a matter of urgency so that not a single person goes home and maybe you wait a couple of hours before they are debriefed, because that's where the problem might be able to strike.
No, I fully agree with the issue of strengthening the service, especially the human resources. We are currently, since since the new minister joined us, he commissioned a project where we are looking at redefining and repositioning EHW within SAPS. So we are calling in on external providers, academia, experts and staff, where we are going to have a 3-day conference looking at how best we offer services, what is the impact of what we are currently offering, and reviewing our program and repositioning EHW. But
looking
the
at
services.
Pardon me, Major General, pardon me for coming in there, but looking at the urgency of this situation, these are members that are not only contending with the different scenes that they are seeing, these are members that are also contending with the rising cost of living, for example. There's a myriad of challenges that are faced with currently in South Africa. Do you have time to be conducting this particular 3-day workshop and not urgently maybe beef up where you can while you are implementing means to try and address this?
No, we are looking at options. Currently, we are also even having peer educators, GBV peer educators. We are also looking at the issue of LGBTQI. So we've got different means that we are using as force multiplier in order to strengthen the services that we are offering. So even the services that are offered by PolMed and even within SAPS, we do have other social workers and staff who are not currently working within EHW, but we are calling them on in order for us to strengthen the numbers, because to make sure that while we are looking and exploring at redefining EHW, there are services that are being offered. Because even the scenario that we are painting of an officer, we mainly depend on commanders to refer members timeously to EHW, and EHW is available on a 24-hour, 7 days notice. Whenever you need our service, we do have standby services, even currently as we speak, where you can get assistance. It's just that we don't have EHW members at station level, but we do have those standby resources where they can even drive to see the police officers or even debrief them, depending on the time that they were referred by the commanders or they referred themselves.
How quickly do you ensure then that you've got these officers at every station?
You mean
the implementation of that? How quickly do you envision it? Because it sounds like, as you say, it's a resource issue, but there are challenges at station level, and you say you don't have these EHW officers at station level. So according to your own assessment as the head, how quickly can you then be able to have a turnaround situation where you have all officers available at every single police station?
We are looking at having them by early next year, January.
Okay. All right.
Yes.
Thank you, Major General. Thank you so much for your time this evening. Appreciate it. And as you say, you're contending with the issue of resources as well. But it's heartwarming to hear that there's also measures that are being put in place in terms of private services to try and assist you. But certainly this is a desperate situation. That's Major General there, Busi Temba, SAPS Employee Health and Wellness Head.